Hello, bonjour, Calgary. Did you know that at least 238,000 people speak Français in Alberta and that 90,000 live right here in Calgary? Oui, oui, c'est vrai. It's true. And now, thanks to Shaw Community Access Programming, we get to reach out to everyone to let you know all about our special people, places, events, and activities happening in this fair city in both English and en français. That's right, mes amis. We begin the first part of our program in English and then we repeat it en français. So stay with us. Welcome to our program today. My name is Anne Boiteau and we're chatting with Dr. Marc Klasa.
Hi there.
Hi, welcome. So, Marc, can you tell us a little bit about your background and how you decided to go into medicine?
Sure. I grew up in Montreal, and basically I had some experience with the medical profession because my brother actually went into medicine a number of years before me.
Okay.
And it just seemed that he had a real wide selection of things he could do, that he really enjoyed the job. And it seemed like there was also a lot of freedom to do what you wanted to do and a lot of control over your own life. So I thought, this sounds interesting. So basically that led to my interest in pursuing that career.
Your parents were not doctors? Or...
No. My mom was a school teacher in Montreal for about, well, probably pushed about 40 years in the elementary schools in the Catholic system. But then near the tail end of her career, she actually wanted to do something different. So she got training teaching English as a second language. And she actually worked doing the TESOL program in the Francophone high schools.
Ah, interesting. And did you speak French or English as you were growing up?
And it was mostly English. But my parents realized the value in knowing both languages. And my dad actually worked as a manager for Handy Andy. They were kind of a Quebec equivalent of Canadian Tire at the time.
Oh, okay.
And so obviously he needed that skill set to work in. So actually they took it a step further and to make sure that I did have those skills, though I started out in the Catholic school system when I was in elementary school, because there was far better French immersion programs in the Protestant system. I shifted over to the Protestant system for high school and I actually did complete it and get my bilingual certificate.
Oh, good. And how did you end up in Calgary?
That one there was I completed my med school, and I did get offers and then kind of recruited for residency programs at McGill where I'd done my med school, but I wanted to do something different and I wanted to actually travel a bit more because I had essentially lived all my life in Montreal. So I put in my applications for the family medicine, which is the specialty that I thought would be the most interesting because there's such a variety. I could laughingly say that I might have a little bit of ADD. And so this gave me a lot of opportunities to always have something new to deal with on a daily basis. And so in so doing, I figured I'll put in my application for residency and just see who offers me an interview. And then I'll do the tour and I'll talk to people and I'll see what comes about. Because I really didn't know much about the schools outside of Quebec and Ontario at the time. So, got that opportunity. And
you went to Edmonton.
Went to Edmonton, yeah. The interview there went well. And I also kind of liked the level of quality of education that you could get at the University of Alberta, while also living in a city that on essentially a student budget was quite affordable, such that you could actually combine the best of both worlds. So in the end, I ranked it as my #1 choice. And I don't know if you're aware of how the ranking systems work. The candidate ranks of all the places that offer them interviews, one on down the list of where they'd like to go. And then the schools themselves rank the candidate, as in, are you the first candidate they'd like to have,
yes.
the second, the third? And I was lucky. I matched to my first choice.
Oh,
so I came out to Alberta and moved to Edmonton in 1995 for my specialty training.
And did you know at that time that Edmonton was had so many francophones and a francophone community?
To be perfectly honest, I knew very little about it. The only part in Western Canada where I'd visited regularly beforehand was Vancouver, because that's where my brother had moved to, and that's where he was practicing. So basically, I went just with an open mind, and I ended up doing most of my training at the Grey Nuns Hospital. And my preceptor, the great Dr. Phil Klemke, was, before he joined the teaching staff there, he had an independent family practice office that was in the same building on the west side of Edmonton as an equally great doctor who I spent 3 months with in second year of residency, the Dr. Lucy Bernier-Laika. And it was through Lucy that I learned about the Francophone community and tied in with the Francophone community.
And now you're in Calgary,
right?
And you have a bilingual practice?
Pretty much. Around, I would guess, around 40 to 45% of my practice is Francophones. And of the remaining 55%, a whole mix of all kinds of languages. Because it's in the northeast of Calgary, which is essentially working class neighborhood, but with all ethnicities, recent immigrants, a whole mixture of people, but it's the same type of neighborhood, and that's why I feel so comfortable, as where I grew up in Montreal in St. Leonard. Because again, it was kind of the same type of working class, mixed culture neighborhood. And I really enjoy it. I think it's a fun place to work.
That's great. And you specialize in diabetes and chronic pain management, right?
To a degree. I still do on the full cradle to grave family medicine and see all domains, all types of conditions. But because I was diagnosed myself as type 1 diabetic when I was 14 years old. So when I first moved to Calgary and started working, setting up my own practice, I did what any good diabetic is supposed to do. Stop in, and my family doc made a referral, and I went to the diabetes center. And they met up with the people there. They said, well, your sugars are well at target, your blood pressure is good, everything's good. You can just continue to follow up with your family doctor. Really not much else we can really recommend for you here, and keep doing what you're doing. So I said, oh, okay, that's fine. And then I was about to leave the office when the reception nurse flagged me down and said, excuse me, Mr. Klasa, yeah? Are you a physician? Yeah. Family physician? Yeah. Are you accepting new patients? Which at that time I was. So I ended up getting tons of referrals of diabetic patients from the diabetes center. So kind of my subspecialty kind of found me. I didn't really search for it. And it worked out really well. And about nowadays, I'd say probably around 45% of my practice is either type 1 or type 2 diabetics. And then, how did the whole chronic pain thing develop? Well, I inherited a lot of these patients, and some of them had not really been followed by any medical team whatsoever for many years. We got their sugars under control, but that did not get rid of burning pain in their feet from diabetic neuropathy or diabetic nerve damage. And at that time, I didn't know a lot about pain management, but I knew the chronic pain clinics, and I talked to a lot of the guys there, but the wait times were rather outlandish, even worse than they are nowadays. So one of the chronic pain docs said, well, you know, there's a lot of good conferences on the topic. You know, if you want to take it to the next level, maybe do the old med school equivalent, see one, do one, teach one. So I went to a number of conferences and preceptorships. Kind of got good at it as time went by, I guess. Apparently I'm doing well.
Your patients think you're doing really well.
And so eventually, I started treating my own patients instead of making a lot of referrals. And then as time went by, I guess others took notice. So I actually got recruited, and this is where I work Wednesdays now, to run the chronic pain medical management program at the Calio Spine Clinic here in Calgary, with all the spinal surgeons and the rehabilitation medicine specialists and what have you.
Wow.
And also got kind of lassoed into it, but apparently, as my wife says, I have trouble saying no to help out. And then ended up being recruited to be the founding president of the Pain Society of Alberta, which is an organization of all domains of medical specialists or therapeutics that actually treat the chronic pain conditions. So we have physicians, dentists, psychiatrists, psychologists, physiotherapists, chiropractors, massage therapists, pharmacists, all in one organization. And we meet once annually for a mega conference that this year will be held in Banff because it got so large that we outgrew our previous conference site in Canmore. We get about maybe 100 to 120 people expected this year to come out for that conference.
Awesome.
And now I'm just a board member, nothing more than that. I'm happy with that. But the organization seemed to have worked well, and it also provides a great web resource for interaction, not just, patients with chronic pain can actually look it up at www.painsocietyofalberta.org, but also more importantly, there's member sections. So there can be chat rooms between other treating practitioners. Yes. We just kind of bounce ideas off each other to come up with the best treatment.
That's awesome. That's awesome. And when you have a little bit of free time, you also do seminars, information sessions on different things?
Basically, because of, I guess, that's one of the nice things about family medicine. As years go by, if you kind of find your own subspecialties or the things you like to spend more time doing, and if you have the experience, people also want to hear about your experience and and kind of pick your brain about ways to help out their own patients. So as the years went by, I got drafted to do a number of conferences, sometimes for physicians, sometimes allied healthcare personnel, sometimes even just for the general public, on 3 different topics: diabetes management, both type 1 and type 2, chronic non-cancer pain management, and also a little bit on the management and prevention of diabetic high blood pressure and kidney disease. So I've kind of done all of those things, and I do talks for physicians predominantly, but sometimes for allied healthcare personnel and the public as well. And it's kind of fun. I've gone to a number of places, not just in Calgary, but across Alberta. And I've done talks in Red Deer, Lethbridge, going to be going to, I think, Drumheller in the next week or so. I'll have to check the schedule. And it just kind of allows me to also interact with a lot of physicians and a lot of other healthcare personnel.
It's good
in
to
these other areas.
network.
And the network, it can't be understated. Because sometimes also, it's fun to actually give those talks, but you sometimes learn yourself too. Somebody brings up a case, an approach they took, and you think, whoa, that was a great idea.
Yeah.
I think I want to use that when I get back to my office.
Yes. And you ended up in the Calgary Sun at one point. What was that about?
That was a rather unique circumstance.
Yeah. Tell us about that.
That was at my previous office. I used to be I'm a family physician in Martindale, and my partner was the great Dr. Sadru Adatia, who continues to practice nowadays in Royal Oak here in Calgary. And I was just new at the game at that point in time, so I was often seeing some of his patients at times. And we used to be open on Saturdays for any of our patients who had anything urgent or walk-in or what have you. So I was actually working that Saturday, and one of Dr. Adatia's patients came in. And the gentleman had a long heart history, and he just mentioned that morning he had felt really kind of fatigued and a little bit dizzy, so he thought he should come in and get checked. And he was being kept on multiple blood pressure medications to keep his blood pressure really perfect. And when I did check his blood pressure, it was running a little bit low, so maybe that's why he felt a little bit dizzy. So we were about to write it off, but he said, Doc, years gone by, on my first heart attack, the only symptoms I had was dizziness, and I kind of flaked out, and the next thing I remember, I was at the hospital. Oh, okay. So basically, he didn't have any other symptoms. Everything else checked fine when I examined him that day, but I didn't want to take a chance. So I sent him to the lab for a test to check if there was any possibility he might be having a heart attack. Test result usually takes only about 3 to 4 hours to come back when you order it stat. And if they don't contact you back right away, it usually means that the lab has seen that it's normal, and so they'll just fax it back to you or send it out in the normal.
And by
stuff.
that time, you had to go and find him, eh?
Well, I ended up leaving the office.
This is all the time we have. I'm sorry, but
no worries.
You found him.
And basically, that was a great time.
Yeah.
He was happy.
Thank you for being with us.
No worries.
It was great. Thank you, everyone, et nous continuons en français.